in terms of what's actually causing your lower back pain, it's hard to visualize. So the report describes this phenomenon of sacralization or this pseudo joint, and I think that's actually what's causing your pain. So it's not dangerous. It's not something that needs medical attention. However, it can be painful from time to time. A few ways to treat it. One, keeping up with your core strength, maintain the exercises that you've done in physical therapy. You could always consider a cortisone injection to that area just to reduce inflammation whenever it's really flared up. The back brace can be helpful at the end of the day. Surgically, they could resect it. You can cut away this bone so it's no longer contacting the area. However, I can almost guarantee you that a surgeon would want us to inject this area first. Number one, to see if that's absolutely where the pain is coming from. And two, see if that fixes the problem. Because you were born with this. This is not something that's grown. It's not a tumor. It's congenital. You've always had that. Bone has become more sclerotic.
What does sclerotic mean?
Sclerotic means the bone, as you develop osteoarthritis, the stress on the bone reacts in such a way to make it stronger, and that's called sclerosis. It's just making the bone stronger or more dense. So that's confirmed on the MRI that you have this extra bone on the right side is right about where you're pointing to. Most people, their bone, they look symmetric. This part of the bone is symmetric to that. It looks it's identical. If you put a mirror right side by side, it looks exactly the same. However, in your spine at the very bottom here, you developed more bone than we typically see in this area. In your case, half of the lower portion of the spine is almost fused, but didn't fully fuse, and now because of that, it's causing this rubbing sensation in that area.
And so what? I guess maybe they're being able to touch a little bit more because I'm getting older and things are compressing more, or
it's possible, but I think it's more the fact that over time this is just has reacted and gotten more irritated, and at some point it just creates a flare in your lower back. Now you're feeling the spasms. But I don't necessarily think that this bone is growing, but you're right in the sense that if this starts to compress further, does that put more stress on that area? It very well could. Yeah. The pain that you're experiencing at this moment is unlikely related to that disc degeneration. And more likely related to this anatomical variant in your lower back that is seemingly more symptomatic at this point in time. This is what I'm talking about, partial lumbarization of the upper sacrum. So what they're actually describing is not the fact that this bone has created like an extra bone here. They're suggesting that a part of the sacrum, the tailbone, is incompletely fused here to the point that this upper segment looks more like a lumbar segment rather than this one piece of sacrum. Again, you were born, this is congenital. Yeah. So
I'm a mutant.
And it's actually the same. You're like, well, I see that on the one MRI report. This one says something else. Pseudoarthrosis is that same phenomenon, right? This transitional segment that I was talking about is developing like this little this joint here. That's this pseudoarthrosis.
Going forward, what are your recommendations?
So it seems to be fairly symptomatic if you're having to wear the back brace a few times a month, right? I'm just thinking if I was in your situation, I would probably set up for a cortisone injection into that pseudo joint. One, to bring down the pain, but two, just to have a better understanding, is that actually where my pain is coming from? Ideally, if you're able to get back into physical therapy, I don't know what your schedule is like. I'll leave that up to you. But so acupuncture is helpful for chronic low back pain, and has been proven to be so. Is it going to make that piece of bone go away? No. Can it potentially help with the inflammation, reduce like any kind of muscular spasm? Absolutely. When you're talking about any kind of disc surgery, usually we're talking about, and I'm sure we've had this conversation in the past when you're having different types of symptoms, is that usually you're considering a disc surgery or discectomy because of something like this. The disc collapses, pushes back on the nerve, and causes searing pain on the leg. And then surgically they can go in and cut away that disc material. So clearly we're talking about doing surgery because the nerve is compromised. This is very different. If they were going to do surgery, This is very superficial, nowhere near that disc or nerve, and cutting away extra bone. So that
Okay.
this is just letting you know that what are we talking or fusing, depending on what they would recommend. I imagine they would probably cut away the transverse process. So very different surgery. Risk is very unlikely to cause that drop foot, but in most cases, I would imagine if you were to meet with a surgeon, they would strongly advise against surgery, because the reason they're recommending surgery for most patients is because of that fear of drop foot if you don't move forward with the surgery.
Sure.
So just letting you know that there is essentially no risk of drop foot if you were to go the surgical route for this specific problem.